Okay, thank you so very much for that lovely introduction. So good evening, everyone, and thanks again for the opportunity to present this evening. And so this evening's talk then will be on baby skin microbiome. Next slide, please. So my first few slides will quickly recap the basics of skin physiology before delving into the topic of the skin microbiome, with an emphasis on the baby skin and the latest research that's available. At the end, I've included some considerations for care and how a minimalistic approach could be beneficial to the microbiome. Next slide, please. Okay, so the skin is the body's largest organ, and it has three primary functions: protection, regulation, and sensation. The stratum corneum is the outermost layer and acts as a protective barrier against microorganisms, chemicals, and allergens. Next slide, please. If you compare a baby's skin to adult skin, babies have a 20% thinner epidermis and a 30% thinner stratum corneum, so much thinner than an adult. Next slide. And they also have smaller corneocytes and less natural moisturizing factor present in the stratum corneum. And because of this, there's a faster rate of water loss from a baby's skin, so more prone to dehydration. And this results in a less effective skin barrier function. Next slide, please. So as a baby grows through the first 12 months of its life, the skin continues to develop. The barrier function of the epidermis and the stratum corneum gradually increases. And by 12 months, the skin barrier has matured enough and the water handling function of the baby's skin has been optimized. Next slide. So we now know, and this is a rapidly growing area, that within days after birth, or the baby's skin is exposed to a variety of maternal and environmental microbes that rapidly colonize the skin surface. And so this whole area is the area of the skin microbiome that we're hearing more and more about. Next slide, please. And so what the microbiome is and what it usually refers to, it's a term that includes microorganisms, their genomes, and environmental conditions in which they live. The microorganisms vary between different individuals and different skin sites on the body. And it differs a lot between adults and children and newborns. The majority of the bacteria on the skin is commensalistic, which means it doesn't help nor does it harm the skin. And the other part of the bacteria is mutualistic, which means it helps the skin and it benefits the microbes themselves that live there. Next slide. So some of the latest scientific research suggests that the establishment of microbial communities begins in utero, and that this may prepare the infant's immune system for the challenges of the external environment when it arrives. However, much more work needs to be done in this area, as this currently is only in a hypothesis and is contested by some people who believe that in utero is sterile still. Next slide, please. So the first major microbial colonization of newborns occurs at birth, when newborns are seeded with the mother's microbiota. Infants, if you click, the more information comes up. So infants born via C-section are typically colonized by commensal skin bacteria, while infants born via vaginal delivery are typically colonized by vaginal microbes such as lactobacillus. But the evidence in the literature suggests that these initial differences disappear within a month of life, so that there is no real difference after 4 or 5 or 6 weeks with the bacteria that's on the skin. And the fact that this initial difference disappears after 1 month questions the techniques of vaginal seeding, where gauze swabs are placed in the vagina during C-sections and rubbed onto the baby's body and face after birth, with the idea to transfer the microbes they would have been exposed to had they been delivered vaginally. Next slide, please. So at birth, the microbiome on the skin is homogeneous and not site-specific, unlike adults. If you click again. So the table on the right shows that in the neonate, bacteria is not differentiated by site, as there's no difference in the amount or the type of bacteria present in the nose, mouth, or skin. So if you look at the section highlighted in blue, you can see that lactobacillus, Gardnerella, and all of the other bacteria are all pretty much the same when you look at the nose, skin, or mouth of the neonate. However, if you look at the mother, you can see that Streptococcus is largely specific to the mouth, Carina bacteria is specific to the nose, and Propriana bacteria is specific to the skin. However, it does seem that bacteria begin to demonstrate body site specificity within a few days to weeks after birth. Gestational age at delivery also seems to impact the skin microbiome, with full-term infants exhibiting an increase in the different types of genre present, and preterm infants having fewer genre present. Some suggested reasons for this may be that the skin is not fully developed, mode of delivery might have an impact, the use of antibiotics, or even the hospital environment of where the baby is sleeping or lying. So within the first year of life, the number of bacteria genre does not change, but the relative abundance of the genre fluctuates. So next slide, please. So, no, sorry, the one before you. So as a child grows, sorry about this, as a child grows then from infancy to adulthood, the composition of their microbiome evolves. The healthy pediatric skin microbiome is distinctly different from adults. And similarly, the contribution of microbes to pediatric skin disease may very well be unique as well. The diagram then on the right highlights the changes in bacteria present on the forearm of an individual over their lifetime. So in the beginning of life, when they're between 0 and 6 months old, the forearm is dominated by 3 different genera. As the child grows, these 3 genera become more abundant, and more genera are detected again in greater abundance, and at puberty, the forearm skin microbiome stabilizes and becomes less diverse. Next slide, please. There are many factors that influence the skin microbiota, and some of these include gestational age, parental skin, feeding type, environmental surfaces, and caregiving equipment, as well as antibiotic use. So this diagram shows a list of prenatal, neonatal, and postnatal factors that contribute to the bacterial gut composition in infants. So there's a lot of information in the literature about gut microflora as well as skin microbiome. So early life is a critical period for the establishment of both the microbiome and immune responses, and it seems to have long-term implications for health. Next slide, please. So then dysbiosis occurs when the skin microbiome is altered from the normal healthy microbiome. It's often present in many skin pathologies, including atopic dermatitis and nappy rash. Damaged skin has a decreased bacterial diversity and often an increase in the presence of Staphylococcus aureus. And Staphylococcus aureus is the dominant microbe in atopic dermatitis. And in nappy rash, Candida albicans and Staphylococcus aureus are most frequently isolated from the affected area and are therefore thought to have a predominant role in nappy rash. So this dysbiosis may be occurring because of an imbalance in your skin microbiome or in the baby's skin microbiome. Next slide, please. So as I mentioned earlier, early life is a critical period for the establishment of both the microbiome and the immune response, with long-term implications for health, and disruptions in the skin barrier function and early colonization predisposed to local and systemic immune dysregulation. So this dysregulation is implicated in eczema, food allergies, asthma, and potentially other inflammatory conditions. So understanding the modulating factors during this period could lead to targets for disease prevention in the future. Next slide, please. So over the past 2 decades, consumers have been educated in performing extended beauty and cleaning regimes for themselves and for their family, with numerous personal care products for both themselves and their families. And this has led to the skin microbiome being put under severe stress, where excessive personal hygiene will wash away microbes. Exposure to preservatives from numerous personal care products can kill the microbes. pH of products may adversely affect the microbiome. Abrasion by rubbing or clothing may remove microorganisms, and too much desquamation, which is the shedding of the skin, will result in the shedding of the microbiota as well. So what's the answer? And I suppose more and more people are coming out that less ingredients and simpler routines seems to equal less potential microbiome interference. Next slide, please. So timely and proper establishment of a healthy skin microbiome has a pivotal role in denying access to transient, harmful, and potentially infectious microbes. The early period in skin development could affect long-term microbiome stability. In adults, sensitive and irritated skin is a rapidly growing problem. Reports of sensitive skin have increased by more than 25% in less than 20 years. And we all know that sensitive skin is more prone to infection. And the pediatric skin microbiome is a largely understudied area, but it does provide an exciting area for future research, which I'm sure we'll hear more about in the next decade. Thank you.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.